Hello everyone, welcome back to my YouTube channel. So today we'll be talking about a very important, sweet and short but scoring chapter from Park's textbook of Contemporary Medicine. That's occupational health. So firstly, you need to know the joint ILO or WHO definition of occupational health, along with what is ergonomics. And first, we start with the health of the worker. What determines the health of the worker? We have the occupational environment in which we have man interactions between man and physical agents, chemical agents, biological agents, interactions between man and machine, and man to man interactions. And then we have occupational hazards, which can be categorized into physical and chemical broadly. Under physical, we have heat and cold, light, noise, vibration, UV radiation, and ionizing radiation. Under chemical, we have chemicals that act by local action, inhalation, and ingestion. Under inhalational agents, we have dust, gases, metals, and compounds. Then we also have biological hazards, mechanical hazards, and psychosocial hazards, which include psychological and behavioral changes and psychosomatic ill health. So now we have occupational diseases, which can be based on the causes. They can be broadly categorized into physical caused by physical agents, chemical agents, biological agents, occupational cancers, occupational dermatosis, and psychological diseases. Now, under physical agents, we have heat, cold, light, pressure, noise, radiation, mechanical factors, and electricity. Under chemical agents, we have gases, we have dusts, which can be inorganic or organic particles. So broadly, we can categorize them as pneumoconiosis. Metals and compounds, chemicals and solvents. Next up, we have the definition of pneumoconiosis and the various types of pneumoconiosis, which can be due to inorganic particles and organic particles. So, coal dust induced pneumoconiosis is known as anthracosis. By silica, it's silicosis. Asbestosis. And by iron, we have siderosis. For organic particles, we have cane fiber, bagasosis, cotton dust causing bicyanosis, tobacco dust causing tobaccosis, and hair grain dust causing farmer's lung. So there are a few important points that under each pneumoconiosis that we all need to know. So for silicosis, we need to know the factors affecting silicosis and the various methods of prevention like dust control and regular health examination of workers, and also the industries involved in silicosis. And basically, the lymphatics get blocked, which causes dense nodular fibrosis, which reveals a snowstorm appearance on X-ray. Silicosis is known to increase the TB risk. And for anthracosis, which is basically a simple pneumoconiosis which causes progressive massive fibrosis. Bicyanosis ends in chronic cough and emphysema. Bagasosis is caused by thermoactinomyces saccharine, which causes acute diffuse bronchiolitis, which is seen in a skiagram as mottling in the lungs. So here under preventive measures we have as usual dust control, personal protection, medical control and bagasse control. Now for asbestosis, which increases the risk of mesothelioma, we need to know the different forms of asbestos like serpentine and amphibole. Under amphibole we have crocodolite, amosite and anthophyllite. And farmer's lung is caused by a microbe called Micropolyspora phenai. Now, it's the crocodolite form that increases the risk of mesotheliomas in the lung. So, the main clinical findings are nodular fibrosis in the upper part of the lung, asbestos bodies in the sputum, and ground glass opacities in X-ray, which are bilateral. Plus the usual preventive measures like using safer types of asbestos, substitution by other insulants, dust control, rigorous measures, periodic examination of workers, and research. Next up, we have lead poisoning. So we need to know the uses of lead, the various sources and routes of exposure, and the clinical features of lead poisoning, and how do we diagnose broadly by history, by clinical features, and the lab tests, which include coproporphyrin in the urine and aminolevulinic acid in the urine, blood and urine levels of lead itself, and of course basophilic stippling in RBCs. And here are some important values for the tests. So, coproporphyrin in urine should be elevated above 150 micrograms per liter, ALAU above 50 milligrams per liter, lead more than zero point 0.8 milligrams per liter in urine, and more than 70 micrograms per deciliter in blood to be diagnostic of lead poisoning. And for methods of prevention, we have substitution, isolation, local exhaust ventilation, personal protection, regular housekeeping, maintaining a good working atmosphere, periodic examination of workers, personal hygiene, and health education. Now we have occupational cancer, which the ones mentioned here are skin, lung, bladder cancers, and leukemia. So under skin cancer, we need to know that um, Percival Pott was the one who is a pioneer in uncovering this association of scrotal cancer in with chimney sweeping. And then in lung cancer, we have asbestos, we have factors like asbestos, radioactive mining, etc. And bladder cancer, and aniline is an important notable carcinogen, and benzol for leukemia. So, what are the usual characteristics of occupational cancers? It's associated with prolonged exposure, usually 10 to 25 years of onset, and it can develop even after the cessation of exposure to the agent. And the age incidence of the cancer is earlier than what happens for the same malignancy in the general public. And tumor localization is relatively constant in any one occupation. So, how do we control occupational cancers? It involves elimination or control of carcinogens, medical examination, inspection of factories, notification of diseases, licensing of establishments, personal hygiene, worker health education, and of course, research. Now, coming to occupational dermatitis, we have physical, chemical, and biological agents causing that, usually categorized into primary irritants and sensitizing substances. So, prevention involves pre selection of materials, protection, personal hygiene, and personal protection. Now, the story is not over yet. We still have more. We have radiation hazards. Now, how do we prevent harm from radiational hazards? You avoid contact, avoid inhalation of agents, ensure appropriate shielding metals being used wherever necessary. 6 monthly employee monitoring of exposure, protective clothing, adequate ventilation, preferably avoid exposure of pregnant women to radiation wherever possible, and 2 monthly health checkups. Now, we also have agricultural hazards which can be zoonotic, accidental, toxic hazards, physical hazards, and respiratory hazards. One of the respiratory hazards is farmer's lung, which we have seen earlier. And we also have industrial accidents, which can be caused by humans as well as environmental factors. Under humans, we have physical, physiological factors, and psychological factors. The physiological factors are bit important, like the it's discussed in a bit more detail, like factors like sex, age, the time of day, the working experience, and the working hours can also affect the the likelihood of an accident occurring. And we also have sickness absenteeism, the causes for sickness absenteeism, which are economic, social, medical, or non-occupational, and how do we prevent sickness absenteeism, plus a short note on good human relations and ergonomics again. Now, what are the various health problems due to industrialization? We have seven health problems listed here. We have environmental sanitation problems, under which there are housing, water pollution, air pollution, and sewage disposal. Then we have communicable diseases. Then we have food sanitation, mental health issues, accidents, social problems, and of course, finally, mortality and morbidity. We all saw the various methods in which workers can get harmed in an occupation. So now, like, we are moving forward. We discuss what are the measures for health protection of workers. Firstly, we have measures like nutrition, ensuring adequate nutrition, then the control of communicable diseases, adequate environmental sanitation, ensuring mental health care, measures for women and children, what are the requirements and what are the various measures you can take, health education, and of course, lastly, family planning. Under environmental sanitation, we deal with water supply, food supply, toilets, and general plant cleanliness, plus other factors like sufficient space, lighting, ventilation, and temperature, protection against hazards, and housing measures. Now, for the prevention of occupational diseases, we have medical measures which consist of pre placement and periodical examinations, medical and healthcare services, notification, supervision of working environment, maintenance and analysis of health records, and health education and counseling. Next, we have engineering measures, which include building design, housekeeping, ventilation, mechanization, substitution, dusts, enclosure of offensive material or processes, isolation of offensive process, local exhaust ventilation, protective devices, environmental monitoring, statistical monitoring, and research. Lastly, we have legislative measures, which under which two important acts are discussed in detail: the Factories Act and the ESI, or Employees State Insurance Act, which were both made passed in 1948. Ignore this, guys. Now, coming to the Factories Act, so we need to know the scope of the act, and which includes the definition of a factory. When running on power, it needs more than 10 workers. Without power, it needs a minimum of 20 workers to be called as a factory. Then we have various scopes, which include the health, safety, and welfare of workers, employment of young people, hours of work, leave with wages, occupational diseases, and employment in hazardous processes. Now, for ESI, we also have scopes and the benefits to employees, which include medical benefits, sickness benefits, maternity benefits, disablement, dependence benefit, funeral expenses, and rehabilitation. The benefits here are mainly monetary, and it's recommended that you know the exact amount for the medical, sickness, maternity, and funeral expenses. Next, we have benefits to employers, which include exemption from three things: the Workmen's Compensation Act, the Maternity Benefit Act, and of course, paying medical allowance to employees. And other benefits include rebate under income tax, and last but not the least, a healthy workforce, which is what we all need, right? This is basically what this whole chapter is about. So, with that, I come to an end of this video on occupational health. Hope this helps in your preparation for community medicine exams. Thank you.